Hey, I'm Dr. Dino Pappas. Thanks for joining me. The views in this video are my views. They do not represent the views of any entity or agency that I may be affiliated with. I've got questions from patients in the office, and I've received emails over the years about this topic right here, spondylolisthesis. First, well, that's a mouthful. Second, what is it and what do we do about it? I'm going to answer those questions, but first I'm going to get to this drawing down here in this schematic. These little black things here are vertebra. Those are the bones in your spine. In an ideal world, all of these bones would be in perfect normal alignment, and that's the green line that you see where this bone, this vertebra, and this bone are in the same plane. What happens in a spondylolisthesis is this area here, there is a fracture, and that's that red circle that you see, and this part of the bone is missing. And what happens is one level translates or moves or slides a little bit more onto the next level. So there is a fracture and a slippage of one level onto the next. So what is spondylolisthesis? A fracture with a slippage. The causes could be traumatic, like you got into a car accident, or you slipped and fell down a flight of stairs, or degenerative, progressive, small, micro trauma to these back portions of the joint that's called the pars interarticularis that occurs over time. So traumatic or small micro trauma, degenerative, that adds up over time. The most important question that you may ask is, well, what do you do about it, Dr. Pappas? There are a couple questions that need to be answered. First, is this stable or unstable? How do you determine stability? You determine stability by having a patient take an x-ray. The x-ray is in the upright position. Then you have them follow up that x-ray where they bend forward here. And you're looking to see if in the standing position versus bending forward and then extending, if that vertebra, that bone, slides more in flexion or more in extension. So if it moves more with movement. If it moves more with movement, then it is unstable. And the importance of that is that it is a higher likelihood that an unstable spondylolisthesis may need aggressive options like a surgical consultation, an injection, or an interventional procedure at some point in time. So instability is something that we know, that we want to know. We also want to know the amount or degree of slippage. If the amount or degree of slippage is so much that it is causing symptoms and it is unstable, again, there's a higher likelihood that it will need aggressive management options versus conservative care. So those are two important questions. The next, is it symptomatic or asymptomatic? It is entirely possible that people will have these conditions of spondylolisthesis, fracture, and slippage, and they have no symptoms whatsoever. In that case, let's let sleeping dogs lie. Leave it alone. If it is producing symptoms and it is not neurological symptoms or nothing concerning like weakness in the legs, these can be managed non-surgically and non-interventionally by conservative care providers like chiropractors and physical therapists. All right. So is it symptomatic or asymptomatic? The other important sign, is there any neurological signs? What are we looking for? Of major importance, weakness in the arms and the legs. You can't hold a coffee cup, or your legs are weak and you're going to lose your balance and fall over as a result of pain, or just you can't sense where your arms or legs are at. Those are concerning things, and there's a higher correlation. A patient may need an interventional procedure, an injection, or a surgical consultation if there's hard neurological sign. Again, weakness in the arms, weakness in the legs. So the options, leave it alone. If it's asymptomatic, it's not causing problems, let sleeping dogs lie. Conservative care, if it's symptomatic, it's stable, and there's no significant neurological findings. Or interventional or surgical procedure if they're symptomatic, unstable, and have those significant neurological deficits. I hope this clears this up for you on the topic of spondylolisthesis. I'm Dr. Dino Pappas. Hey, do me a favor, hit that subscribe button for more informational videos and turn on those notifications. Thank you.